Nobody told me that turning 65 had a deadline attached to it. My name is Edward. I am 82 years old. And the thing I want to tell you about today is the 3-month window that most people approaching Medicare have never heard of, and what it costs you financially if you miss it. I was a family physician for 33 years. I ran a private practice in Central Ohio, and for the last decade of my career, I sat on the board of a regional hospital network. I understood the healthcare system from the inside in a way that most patients never do. I understood insurance reimbursement, billing codes, coverage determinations, and the gap between what patients believed their insurance covered and what it actually covered. And I still made 2 of the 5 Medicare decisions I am going to tell you about incorrectly. Not through ignorance of medicine, but through the specific kind of overconfidence that comes from knowing one system well and assuming the adjacent system operates on the same logic. I want to give you what I wish someone had given me before my 65th birthday. A clear and ordered account of the 5 decisions that must be made before your birthday month, because several of them carry permanent financial consequences if you handle them in the wrong sequence or miss the window entirely. The first decision, and I will say plainly that this is the one with the most severe and irreversible penalty for getting wrong, is the decision about whether to enroll in Medicare Part B during your initial enrollment period. Your initial enrollment period is a 7-month window. It opens 3 months before the month of your 65th birthday, includes your birthday month itself, and extends 3 months after. If you do not enroll in Part B during that window, and you do not have qualifying employer-sponsored coverage that exempts you, Medicare imposes a late enrollment penalty of 10% of your Part B premium for every 12-month period you were eligible, but chose not to enroll. That penalty is not temporary. It does not expire. It sits on top of your monthly premium for the remainder of your life on Medicare. I had a patient in his late 60s, a man I had known and treated for years, a retired engineer named Walter, who called my office after I had retired to ask me about a penalty notice he had received from Medicare. He had delayed enrolling at 65 because he had assumed his wife's employer plan, on which he was a dependent, constituted qualifying coverage for Medicare purposes. It did not, under the specific circumstances of his situation, and he had not verified this with a Medicare counselor before the window closed. The penalty he faced was 20%, permanent, added to his Part B premium for the rest of his life. Walter was in good health and expected to live well into his 80s. The financial consequence of that assumption, multiplied across the years he had ahead of him, was significant. Begin the enrollment process no later than 3 months before your birthday month. If you have any doubt whatsoever about whether your current coverage qualifies as creditable coverage for Medicare purposes, call the State Health Insurance Assistance Program in your state. That call is free. The penalty is not. The second decision is whether to choose Original Medicare or Medicare Advantage. And I want to be direct with you about something that the marketing for Medicare Advantage plans does not advertise clearly. Medicare Advantage plans are private insurance products. They are not Medicare. They use Medicare dollars, but they operate as managed care networks, with their own rules about which doctors and hospitals and specialists you can see. For people in good health who live and remain in one geographic area, and whose medical needs are routine, many Medicare Advantage plans work reasonably well. The problems emerge when the medical needs become serious. I will tell you about a man named Thomas who was a colleague of mine, a retired accountant, meticulous about his finances, who enrolled in a Medicare Advantage plan at 65 because the premium was 0 and the plan included dental and vision benefits. At 72, Thomas was diagnosed with a cardiac condition that his cardiologist believed required evaluation at a specialized heart center in a city 2 hours from his home. That center was not in his Medicare Advantage network. The cost of out-of-network care under his plan was prohibitive. Thomas spent 3 months navigating prior authorization requests, appeals, and ultimately a transfer of care to an in-network provider who was less specialized than the original recommendation. I am not suggesting original Medicare is right for everyone. I am telling you that the freedom to access any Medicare-accepting physician or facility in the country without a referral or a network restriction is a form of coverage that does not appear on any comparison chart and becomes invaluable precisely when you are least able to fight for it. The third decision is the one I got wrong myself, and I tell you this without embarrassment because the mistake was not a failure of intelligence. It was a failure of timing that I cannot undo. When you first enroll in Medicare Part B, you have a 6-month window during which insurance companies selling Medigap supplemental plans are legally required to accept you at their standard published rates, regardless of your health history. They cannot ask you about pre-existing conditions. They cannot decline your application. They cannot charge you more because of what is in your medical record. That window begins the first day of the month in which you are both enrolled in Part B and 65 years old. It runs for exactly 6 months, and then it closes in most states. And when it closes, the guaranteed issue protection goes with it. I enrolled in Part B correctly and on time. I did not purchase a Medigap plan during my 6-month window because I was in excellent health, because I had spent 33 years watching patients spend money on insurance they perhaps did not need, and because the monthly premium at 65 seemed like an expense I could defer. I was 69 years old when I was diagnosed with a condition that changed my calculus on that decision entirely. When I attempted to purchase a Medigap plan at 69, the insurer was legally permitted to ask about my health history and to price my premium accordingly. The rate I was quoted was substantially higher than the standard rate I would have paid at 65. I have paid that elevated premium every month since. The decision I deferred because it seemed unnecessary has cost me considerably more than the premiums I was trying to avoid. The fourth decision involves Medicare Part D, which is the prescription drug coverage program. And I want to address both the enrollment timing and the plan selection because people routinely get one right and the other wrong. The enrollment timing matters because Medicare imposes a permanent late enrollment penalty on Part D as well. 1% of the national base beneficiary premium for every month you were eligible but not enrolled and had no other qualifying drug coverage. Like the Part B penalty, it accumulates and never goes away. But the more common error I observed, and one I counseled many of my own patients about over the years, is the plan selection mistake. People compare Part D plans by monthly premium and enroll in the least expensive one without examining the formulary, which is the specific list of medications the plan covers, and at what cost-sharing tier. If you take 2 or 3 regular prescription medications, and those medications sit on a high cost-sharing tier in your plan, you may find that the plan with the $12 premium costs you several $100s more per year in total drug expenses than the plan with the $30 premium that places your medications on a more favorable tier. As a physician, I always told patients approaching Medicare to bring their complete medication list to any Part D comparison and verify their specific drugs in every plan they consider before they look at the premium line. The premium is the least important number on the comparison sheet. The fifth decision is the one that, in my experience as a physician, carries the most practical weight in a crisis. And it is the one that most people approaching Medicare give the least thought to. It is the decision to name a healthcare proxy. and to make certain that person has a complete and current record of your Medicare coverage, your physicians and your medications, before you ever need them to use it. I spent 33 years in medicine. I treated patients across every decade of adult life. And I can tell you without hesitation that the single most disruptive variable in emergency medical care for older patients is not the severity of the condition. It is the absence of someone who knows the patient's insurance details, their medication list, their physician contacts, and their care preferences. When that information is missing, the care slows down, decisions are made without complete information, and the patient who is least able to advocate for themselves is the one left to navigate the gap. The practical requirement here is 1 afternoon of your time. Write down your Medicare number, your Part D plan name and member number, your Medigap or Medicare Advantage plan details, the names and direct phone numbers of your primary care physician and any specialist you see regularly, and your current medication list with dosages. Give a physical copy to your designated proxy. Keep one in your wallet. Leave one somewhere your adult children or closest trusted person can find it. This is not a morbid exercise. It is the same kind of preparation that any organized man who has managed his own affairs responsibly his entire life would recognize as simply the right thing to do. I am 82 years old. I practiced medicine for 33 years and I still made 2 Medicare enrollment decisions that cost me money I did not need to spend. The enrollment windows are real. The penalties are permanent. The Medigap guaranteed issue protection is available exactly once and does not return. The Part D formulary is the number that matters, not the premium. And the healthcare proxy document is the most valuable piece of paper you will ever put in someone else's hands. Your birthday month is not simply a date on a calendar. In the year you turn 65, it is a financial and medical deadline, with consequences that extend across the full length of your retirement. The decisions I have described today are not difficult to make correctly. They are only expensive when they are made without this information in hand. You have time to get them right, but the window opens on a specific date, and it does not wait for a convenient moment. Start 4 months before your 65th birthday. Make the decisions in sequence, and do not let the 7-month window close while you are still meaning to get around to it.